Okay, with that opening, I'm going to turn it over then now to Dr. Barra and let you begin. Dr. Barra, if you don't mind, if I might, however, just read quickly your opening biography. Dr. Massimo Barra is a medical doctor who had two great priorities in his life: the Red Cross, Red Crescent movement, and the recovery of people with drug disorders. He founded in 1976 the Villa Marini Drug Center, which provides a wide range of treatment programs to around 600 people who use drugs a day. He was the first in the world to promote the use of naloxone to non-medical staff for overdose emergencies. Thanks to this approach, over 3,000 people have been saved in the streets of Rome that were about to die from overdose. Together with civil societies organizations, he launched the Rome Consensus II for the promotion of humanitarian drug policies worldwide. He is currently chairman of the Red Cross Red Crescent Partnership on Substance Abuse and special envoy on the health of the IFRC. And most importantly, he is, as was said, the founder of Rome Consensus II, which is the second time around, and his leadership and his motivation and his drive and passion is what really allows all of us to be here today. So Dr. Barra, I'm going to turn it over to you.
Thank you, Chair. This side event is a further step of the Rome Consensus 2.0 Alliance, which is growing every day with new supporters across the world. The RC2 manifesto is designed to bring together civil society organizations, professionals, leaders, and public authorities to explore ways to effectively combine humanitarian attitude in health, criminal justice, prevention, and community responses to addiction problems. Is it possible for the police and drug treatment providers to work together? This is the main question we would like to address today. The spread of drugs and their use is faster than our ability to respond to the problem. Most governments' energies and resources have been spent combating the drug market with the hope of reducing demand. We suggest a different approach. We believe that it is in the interest of each state to reach and treat all drug users. This is one of the founding principles of the Rome Consensus Initiative, to make efforts to provide or improve access to health services for drug addicts. Within this framework, police forces have a key role, and not only in the field of demand reduction. They have easy access to the so-called hard to reach. They meet vulnerable groups on a daily basis, including drug users, and we believe they can play a key role in offering a public service not limited to repression, but that can also be of assistance to those who seek to improve their health. They can even have a therapeutic role. Law enforcement authorities have mainly obeyed the public order priorities with a punitive, repressive attitude. Historically, police and drug treatment providers have an unsteady relationship, consisting mainly of not collaborating with each other. Experience shows repressive measures decrease the opportunity for recovery and reintegration. If we want to improve our community's well-being, every person suffering from drug disorder should have easy access to treatment. In my experience, for example, in the Villa Marini Foundation, the therapeutic drug rehabilitation center I founded in Rome, one of our services is to provide health support to drug users who have been arrested. Our doctors and social workers, at the request of the police, are able to bring various therapies, including methadone, directly to the police station. This best practice, started in the 90s, has a positive impact on the patient who need treatment and also improve the mutual understanding between police and the person arrested. Villa Maraini is a reference point for all the drug users of Rome. We have built up trust, and that's why law enforcement officials call on us to support them when they deal with people with drug disorders. In this way, we reduce violence and we positively influence law enforcement officials who have begun to believe in the value of the health approach. This is the question. Is it possible that in 2022, the police can only arrest these people? Or is it possible that their only goal is imprisonment and not the recovery and the rehabilitation of people in need? The point of contact between the world of law and the world of outlaw is represented by law enforcement, and the change can start from here. The following example of pre-arrest deflection that Jacques Charlier will talk about in his speech represent a valid alternative that can reduce the harm to and increase the well-being of people with the problematic use of drugs. Instead of utilizing traditional police intervention like arrest, charge, and punish, deflection relies on law enforcement to be the referral source to community-based drug treatment prior to potential crisis or violence. We believe that taking charge of people with drug disorders is the first step. Punishment decreases the therapeutic and the recovery opportunities for people with drug problems. It has been shown that when a person is treated, he is less dangerous for himself and for others. And now